guys, welcome to our office. We have our office and surgery center here. We have our overnight area as well. We're going to give you a quick tour of the office side today. We'll do a tour of the surgery center perhaps next week, but as you come in, this is our atrium. This is kind of a shared entrance, and off to the left side is our office, and then off toward that side is our surgery center overnight area. This just is a good area to kind of protect you from, obviously dust and wind and rain. And then we're gonna head over to the office and we'll show you around. Come on. So this is our office. We're gonna go into our kind of the greeting area. We call it a greeting area because we don't want our patients to have to wait. So we don't want to designate it as a waiting area. So as soon as you come in, you'll be greeted by our staff at the front desk, and then we go right back into one of the several rooms back there. And we have a couple of different rooms back there. We'll show you. We have a consultation room, we have a preoperative room, we have a post-operative room, we have a photo room. So we're going to show you that next. But this is just our kind of a greeting room, our entry area. We have just a few chairs, some comfortable seating area. We warmed it up with these two big pieces of wood. The coffee table I actually made a while back at our home, and we brought it here. The big piece on the wall there is about an 800-pound piece of wood that came from an old tree a while back. One of my friends had that at their place, and it spent a couple years in my garage because I wasn't sure what I was going to do with it. And then as soon as we built it, we're like, hey, I think that's a good place to be, just to warm up give some of that organic feel into it. So come on back, we'll show you some of our rooms. This is one of our consultation rooms. And again, it's sometimes can be a little bit nervous having a consultation. So we wanted to make it as comfortable as possible. So as you can see, it's not very medical. I never really liked that anyways. So this is our consultation room, just a couch and a chair. Pretty simple. There's a mirror, couch for the patient and the patient's significant other. I usually sit in my little chair here, and we basically just have a communication. We have our mirror there if we need to look together at any prospective surgical area. We do have a TV on the wall if we need to go through photos or manipulations of some sort. But in general, this is just our consultation room, very comfortable. We have 3 of these. We have a pre-operative room. I'll take you to that one. It's very similar to this. And then we'll show you our post-operative room and our photo room. All right, so we're gonna head over to our pre-op room, and then our post-op room, and then our photo room. So we're gonna head there now. My wife is big into gems, so this is a piece that she found. It's a smoky quartz, if I remember correctly, and it's supposed to, obviously it looks great, but also supposed to draw some of the bad energies in there. So that's kind of our little memento there. And then this is our preoperative room. It's very similar to our consultation rooms. Doesn't have any windows. We do a lot of our breast implant sizing here. And it's a little bit of a dual use. It can also be a consultation room if the other consultation rooms are busy. But again, simple, comfortable couch. I sit in a chair. There's a mirror. If we need to use the TV, we will. And then of course we have regular, regular gowns as opposed to like the paper ones that you usually see in most doctor's office. So just a nice, comfortable gown, nice, comfortable area, just so that we can have a good conversation and understand what we're doing together. All right, let's head over into our post-op room. Our post-op room is a little bit more medical because this is obviously where we see our patients post-operatively. And so, there might be drains to take out and maybe some dressing sometimes. We have a very low maintenance type of surgical way of doing things, but sometimes it does require a little bit more of a medical setting. So more cabinets, there's obviously medical supplies and all those. The chair as articulates, so it goes up and down. Still try to keep it as kind of comfortable and homey as possible, but obviously a little bit more medical because we do a little bit more medical. All right, so let me show you our photo room here. We have a basically photo and video room. It has the black background built into it. It has the lights built into it. And this is where we take our before and after photos. If the patients don't want us to share any of the photos, obviously the photos go into their charts. Very important It's important for the patient to see what we've accomplished, but it's also important for me because I constantly review the photos and the videos in order for me to learn how to do things better. So, you know, constantly, every week, every month, we try to adapt and do our surgeries a little better. This is our photo room, quite spacious, comfortable chair, places to obviously hook up your the gown and then the clothing, and then we have a variety of different disposable underwear, hair clips, hair ties to get the hair out of the way when we do face and neck kind of photos. All right, guys, so thanks for joining us. That's our office there. We showed you a little bit of our entryway in our office. Next week we'll do our surgery center in our overnight area. We're located kind of in the heart of Scottsdale, in the Old Town area where all the restaurants and bars and everything are at. If anyone wants to get a hold of us, 855-377-3782 is our contact phone number, our main phone number there. And of course, you can always get us on Dr.Repta.com or some of our social media sites.